Good day to everyone. Good day to welcome to our synchronous online classes. So in NPA00 or pharmacology. The last time that we had our discussion is in relation to the pharmacokinetics, hoping everyone have accomplished those self-assessment exercises that we posted in the NEO LMS. To continue with our discussion in the pharmacology, we will focus on the topic in relation to your responsibilities and accountability in medication administration. I have reiterated and emphasized this to everyone at the time that we have our initial discussion that a serious task that you will definitely consider in the performance and discharge of responsibilities as nurses is medication administration. And such, to consider medication administration, just recently, yours truly had been involved in some of the concerns that had been addressed in the nursing profession. Nowadays, the government is proposing that we will allow clinical care associates to work in the hospitals. So, clinical care associates are non-board passers or under board who will be allowed to work in hospitals under the supervision of the licensed nurses. In this perspective, there are many questions that basically arises. More importantly, on the area of accountability. And one of the procedures that basically consider in these accountabilities is mainly on the medication administration. Uh, license, uh, licensed and registered nurses are are recognized by our nursing law to perform professional tasks such as medication administration. So that's why if we are talking about clinical care associates, they may not be allowed to perform those tasks since they need to abide, particularly those provisions on the performance of professional tasks. And in that perspective, we need to make an analysis and consider the situations that whenever the clinical care associates may commit the errors, the accountability will be with the licensed nurses. So I think we need to do rather reorientation on this perspective if we will allow clinical care
Bea,
associates.
kalat
Okay,
tapon mo yan, Bakit
clinical
baka
clinical care associates clinical care associates can be allowed to perform on a limited function, but again they could be under the supervision of licensed nurses. As mentioned, there could be possibilities that whenever the clinical care associates may be involved in medication related errors, then it could be accountability of nurses. So these are the issues and trends that we really need to discuss, and we really need to analyze if this will happen in our healthcare settings, how the nurses will manage, how the nurses will decide, will have sound clinical decisions whenever clinical care associates will commit medication errors, how the institution and administrators will facilitate the process, the due process on the perspective that when clinical care associates will commit medication errors under the accountability of licensed nurses. So those are trends and issues that we are now facing in our profession and related to pharmacology. And such, for our nurses to perform their tasks, their professional tasks in medication administration, let us consider the medication checklist. And that is what we call TRAMP. In the United States and other Western countries, they are considering 5 rights of medication. And just to give you a mnemonic, the mnemonic is TRAMP or TRAMP. The 5 rights of medication are very common in some of our pharmacology references. By the way, I will post in our NEO LMS, the primary textbook that we are using in pharmacology and other references, so that you may not just only depend in our discussions on my presentations, but moreover, I am encouraging everyone to be more curious, to boost their neurotransmitters, to read other references so that whenever we do discussions, either online, face to face, or hybrid mode, everyone could be prepared. Everyone has this motivation to share, and everyone could exchange those readings that will give us opportunities to learn from your sharing. So let's go back to the Trump or the five rights of medication. Number one, it is very important for all of us to consider that when you administer medication, proper time is being considered. Proper time because we all know upon the discussion of the pharmacokinetics on absorption, distribution, metabolism, and excretion, time is very important. If we go back to, actually, this is related to the next rights of medication, the right route. We have discussed the relationship of the route of administration and the vis-a-vis with the time, because we are aware that the peak concentration level will reach its effect when the drug reaches the plasma. Can you still remember that? When we discussed that, when we discussed it, we have discussed about 50% that the 50% by which the drug will reach its time. And very significant that the purpose of giving the drug on the uh, proper time is basically to meet the principle of bioavailability, and bioavailability is referring to the 100% effect of the drug. Then we have to consider also the half-life of the drug, which is 50% of the time that you have administered from the onset up to the duration of the desired effect of the drug. So will there be a problem? Will there be a consequence whenever you will not give the time, or rather will not give the drug on the proper time? Basically, yes, as what I have mentioned, it may affect the bioavailability and the half-life of the drug. Um, if there are situations that you will have a gap, for example, when you will be administering an antibiotic or antibacterial, and you will start the administration at 8 o'clock a.m. and will end its whole process of the ADME of the drug on the 4 o'clock p.m. It means 12 noon, which is the half-life of the time between 8 a.m. to 4 p.m. will consider basically the reach of the drug to the plasma, which is what we call half-life. When it reached the half-life, it means the 50% are being processed to be absorbed and to have the physiologic and biochemical reaction, and the other 50% will be considered as a possibility that if it is oral medication, the liver will do the first pass effect and eventually will process excretion via the gut or via the kidneys. In this situation, the remaining 50% will be in process for the next 4 hours. So meaning at the end of the 4 o'clock, it means we have reached the bioavailability, the 100%. So there's a need again to continue or to continue to have another drug to be administered 4 o'clock so that to facilitate the continuity of inhibition of growth of microorganism. Thus, if for example, there are some instances that uh, drugs or medications have not been requested at the time that you will administer the drug at 4 p.m. So non-availability of the drug. Uh, Second, if there could be a possibility that you have considered a gap, that you have not administered the drug simply because of some reservations when it comes to a possible hypersensitivity reactions. Third is if you're awaiting for any doctor's order of chances that this drug will be discontinued. So these are circumstances that probably may not be avoided. But let us think about it. This may cause the possibility that it reached already the first drug from 8 hours of its 100%. So there's a need to continue of inhibiting the growth of the microorganism. Thus, if there will be a gap and you will not administer the drug at 4 p.m., there could be a possibility that it will uh, give an opportunity for the microorganism to what? To have or to start again its growth and multiply as well. So I think this could be a concern by which it may not have the continuity of the inhibition of the microorganism until it reaches its desired effect to complete the dose of the drug and completely inhibit the growth and may cause the prevention of spread of infection. So thus, if you will put in your mind that if there will be a gap in the administration of the drug, which you may have elapsed when it comes to the time, then there could be a possibility that you're also giving opportunity for the clients to experience a possible risk for complication or a possible risk that there could be a risk for infection if the patient is taking antibacterial. Okay, another is we need to also take into consideration the proper carrying out of orders. When you are carrying out orders, you need to consider the proper documentation. And with the proper time, when you encounter OD, BID, PID, QID, you have been oriented that OD is once a day, BID is 2 times a day, TID is 3 times a day, and we have the QID as 4 times a day. However, what would be the proper time that you may consider if it is once a day, 3 times a day, 2 times a day, and 4 times a day? Just a trivia. When we talk about once a day, 2 times a day, 3 times a day, and 4 times a day, it did not match with the medical representation of the drug. If it's once a day, okay, we could say it OD. But if it is 2 times a day, it's supposedly TTD instead of BID. So actually, these are Latin abbreviations. OD meaning omni die, omni die. What do you mean by omni die? That is in Latin once a day. So OD, we have omni once a day, we have OD omni die. Yan. BID, we have by in die. That's meaning 2 times a day. TID, meaning try in die. And if we have the QID, that is what we call quasi in die. So those are Latin abbreviations that by which this will consider the concern that you are aware that this could be your reference to facilitate the proper time of administration. If we say once a day, class, it may still depend. Okay? There are drugs that are given once a day, but it is not just we are aware that if it is once a day, okay, the drug must be given morning, but there are some drugs that are given at night. Okay. Why it is so, sir? There are situations such as maintenance drug or antihypertensive drugs. These are drugs that are given in the morning so that to facilitate the control of the blood pressure throughout the day. But there are some drugs that are given before sleep, but once a day. Why before sleep? If we would try to consider the metabolic activity of the body, metabolic activity is active in daytime. Metabolic activity is slow at the nighttime. So whenever there could be a possibility of effective synthesis of cholesterol, the effective synthesis of cholesterol, since you are engaged in physical activities in the daytime, then your body will keep on compensating to synthesize cholesterol. However, at nighttime, when you are sleeping, metabolic activity are slow. And then when an individual who is diagnosed with hypertension and then have taken a full meal with high cholesterol level, high fat level, there could be chances that digestive activity and metabolism are slow. And there could be chances that the synthesis of the cholesterol or fats is also slow. Thus, we all know that fats are insoluble. Then once fats will be carried through the blood via the plasma, there could be a possibility that this low dense cholesterol, since it's insoluble, it is carried by the plasma through the what we call LDL. You are familiar definitely with that. LDL is you probably encountered it. It's bad cholesterol. That's why it is called as bad cholesterol. But anyway, before we proceed to the explanation why it is considered as bad cholesterol, LDL rather is low density lipoprotein. So from the term itself, low density lipoprotein, it is just hanging and suspending as the blood flows within the plasma. So that's why most of this is called as bad cholesterol, because this cholesterol or lipoprotein that encapsulate the fat may cause the possibility of dislodgement in the blood vessel. Thus, the dislodgement itself may cause the possibility of obstruction. And thus, the obstruction may cause the delay in the blood flow and at the same time may cause a delay in the oxygen supply, which may possibly consider that the patient could experience angina, as what I have mentioned, chest pain, and possibly may experience soon after 15 minutes of continuous chest pain to heart attack. So that's why, what is the primary cause or the factor that has been considered? The cholesterol itself. Now, on that perspective, why it is given once a day at nighttime? Because basically, as what I have mentioned, this drugs, statins, those drugs are statins, which later will be discussed. We'll have a discussion. We'll have a discussion on this. These anti-hyperlipidemic drugs may cause the possibility of synthesizing the cholesterol and will facilitate to prevent the dislodgement. Thus, it is given at nighttime because the reason is before sleep, there is a decreased metabolic activity and higher risk to basically cause dislodgement in the blood vessel. So what is really the important of having the right time? The right time it's being considered because it may lead to the possibility of appropriate physiologic response to the body, just like the principle of the metabolic activities that we have considered and discussed. Another is that time is being considered. If it is once a day, again, it's not what I mentioned. It could be morning or it could be nighttime. 2 times a day. Here in the Philippines, as practice, we are administering the drug at 8 a.m. and 6 p.m. For 3 times a day, we have 8 a.m., 1 p.m., and 6 p.m. Then if we have uh, quasi indai, which is 4 times a day, with 8 4 no 8 a.m. 12 noon, 8 a.m., 12 noon, 4 p.m. and 6 p.m. But again, 4 p.m. and 8 p.m. I'm sorry. But again, it will be the 4 times a day could be depending on the institutional guidelines and protocols. So again, this could not be universally considered as a standard. But again, this may also have a difference when it comes to implementation if this will have a different guidelines and protocols. As a trivia, in medication administration, we're considering, or what we call, if you're considered MAE, as based from the researches, the error rate is almost 60%. And 34%, 34% of out of the 60% medication administration errors are coming from the three. We have wrong time, wrong rate, and wrong dose. And wrong time now is particularly the one that is very crucial in terms of emergency. Okay, there are situations that the drugs are being given to the patients, and it is a responsibility that prior to the administration of the drug, we need to do the skin test. The skin test is very important for us to consider safety of the patient, so that to identify if there are allergic reactions. So prior to administration of any drug, moreover with intravenous drug, there must be skin testing. Even with those who are receiving anti-tetanus, whenever the patient experience wound injury by nails, those items that has rust, which may possibly cause tetanus, the anti-tetanus serum administration or injection may facilitate skin test. Although in most of the situations, we really need to consider if the patient has hypersensitivity reaction because our priority is safety. Okay, let's go back. Let's go now to the next rise of medication. R. Okay, the right route, check its order. Okay, we have already discussed what is enteral and parenteral administration. If you can still recall, okay, if you can still recall, when we talk about enteral administration, these are drugs that are being given outside the GA tract. And if we're considering parenteral administration, I'm sorry, if we're considering the enteral medication, that is within the GI tract, and if we're considering parenteral, these are outside the GI tract. So if you can still remember those route of administration, such as if we have oral medication, if you can still remember the two CASGIP, convenient, common, these are drugs that may cause it absorbs slowly. It can cause GI irritation and typical route for pain. If you can still remember the sublingual, we're talking about TARBs. Being administered under the tongue, absorb rapidly and direct to the bloodstream. Other than that, we have other than sublingual, we have the rectal, which is the RAIT. It is administered by a rectum and absorbed in the intestinal tract. We've also discussed about the various routes of administration, which is very significant for parenteral. We have intravenous, intramuscular, subcutaneous, and if you can still remember the discussion of the intravenous, so these are given directly to the bloodstream, absorb rapidly, and in contrast with absorb slowly with the oral, and this is directly given specifically to reach the plasma. So if we are talking about the intramuscular and the subcutaneous tissue, again, if you can still remember, how many ml do we consider as a maximum administration for the intramuscular? Again, it's 3 ml. So we have mentioned in the intramuscular that it is administered via the muscle. It's less hazardous, okay? Stays longer, stays longer in the blood, and the maximum is 3 ml. While in the subcutaneous, we have considered that it is administered by the fatty tissues, then this will consider administration or volume that can tolerate a zero point 0.5 up to a maximum of 2 ml. Now, the mechanism of this administration is on gradual absorption. So those are basic knowledge, but mainly very important because if we are gearing towards on the efficient way and effective way of administering the drug, route of administration is very basic so that to achieve the desired outcomes and results of the drug. Amount or dose. The right dose is one among the 60% of common medication or medical administration errors. Specifically, 34% are part of it. So actually, with the amount of dose, we're considering the patient's risk of having overdosage and underdosage. We even discussed that even underdosage, the patient will be put on the risk. When we talk about the overdosage, and if it is taken orally, again, the two major organs that we have considered that will greatly be affected is the kidneys and the liver. If you go back to the discussion that we have in the pharmacokinetics on the ADME, that the liver will basically consider detoxification, and its excretion is via the gut or through the kidneys. The overdosage may greatly consider and contributing factors to toxic effect. So that's why nurses, you really need to have a mastery of what could be the antidote that must be considered whenever you administer drugs that may possibly risk for toxic effect. Now, certainly, what could be the basis of nurses to identify if the drug is in toxic level? Drugs can be identified on toxic level if there will be a serum test. Serum test that will consider if it is on the therapeutic level, then we're talking about numbers. Numbers that will identify if the range or results is within the therapeutic level, meaning at the normal and acceptable level. That once the patient have results of toxic level, which is beyond the range, then that's the time nurses, you need to have alert. Alert, meaning you need to prepare the antidote to counteract the possible toxic effect. Because as what we have discussed, if we have toxic effect, these are serious adverse reactions that may consider life-threatening conditions, and it will put the patient in danger. Next, the right medication. On the right medication, again, it is expected that in the pharmaceutical world, we have different brands. But one thing that will really guide us on the classification of the drug is mainly on the generic name. Okay. The generic name will basically identify its classification. Later on, as we go on with our discussion, we'll have our uh, uh, discussion certainly on suffixes. And you will realize that suffixes are very important for us to be familiarized because it will really guide us on how to facilitate specifically classification of drugs. So just to give an example, I'm always mentioning this in our class. So I have olols, metropolols, atenolols, propanolols. So these are drugs that are considered as beta blockers. So if you're aware of the right medication, you could be aware of the right education and right education that you will share to your patients, because the classification of the drugs will will mainly guide you on the pharmacodynamics, which is the mechanism of action. Just like what I have mentioned, when you are administering orals, these are beta blockers. So from the classification itself of beta, beta is what? Beta is electrical impulse. And if we block the beta, the action of the beta 1 is transmit signal to the heart so that to facilitate contraction. Thus, if we are considering to block the beta 1, then it will block the electrical impulse so that to stabilize the muscle contraction. So when you are facilitating your education or health education to your patient, whenever you administer any drug such as beta blockers, it is very important for you to explain it in layman term so that your patient will establish rapport with you and the trust and even cooperate whenever there is a need to report adverse reactions. Right patient. Okay, we have identified the right patient, but there are some situations that will really consider how we could be reliable, how we could be effective in identifying the right patient. For the right patient, if the patient is unconscious, then we are considering the ID band. Okay, the ID band. And usually, if the patient is conscious, one of the best way, or actually the best way, not one of the best way to consider identification of the client is mainly ask the patient. Okay, ask the patients on their name, because this will give us also the assessment on their comprehension, on their orientation. Then if there are situations that the patient is disoriented, then that's the time that you may check it by ID band. It may not be by chart. It may not be by bed tag. It may not be by room names or numbers, because this could risk the possible problems with the identification of the right patient. Again, if there are questions, the chat box are open for any questions and inquiries. Can I see thumbs up so that I may proceed to the next slide? If there are no questions, can I see thumbs up? If there are no questions, I'm seeing thumbs up as a proof that our discussion or the topics that had been discussed are clear. So thank you. I have seen thumbs up. Thank you so much for your thumbs up. Then that means that the discussion of this topic on the rights of medication are clear. Then we'll proceed to rights of medication, not just only 5 rights. Here in the Philippines, as what I have mentioned, we may have 10 rights of medication and we may have 12 rights of medication. That's why this could be dear patient red. This is just a way so that uh, remember those terms that will guide us. But later on, I'll be showing to you what are these 12 rights of medication. So with the 12 rights of medication, just remember the dear patient led. And this is what we meant by this dear patient led. Number one, on the 12 rights of medication is right documentation. Um, Actually, on a perspective of medical legal, it is very important that the nurse must be alert with how she will protect himself or herself. The proper documentation will be the one as considered as a basis, as a legal evidence that you are performing your professional task. Just like for administration of drug. For administration of drug, you need to document if the drug was administered. Because whatever happens to your patient, the doctors, the medical legal officers will check if the drug was administered. And in this perspective, what could be the evidence that the drug was administered? When you affix your signature, when you provide the proper documentation through the narrative charting, and if you identified any of the vital signs and adverse reactions that is very important and may take risks to the patient's condition when it comes to medication administration. On the dilemma that I have mentioned to you in the situation we're in, the patient and rather the patient and the relationship of patient, the registered nurse, and the clinical care associates. Again, with the clinical care associates, are they capable? Are they capable of identifying adverse reactions? Definitely yes. Are they part of documentation? Definitely yes. But again, when it comes to the accountability, it will be with the registered nurse. So when the nurse administered the drug to the patient, she must be very consistent. Consistent that since she is the one who administered the drug, she must be the one who definitely and will need to affix his or her signature in the medication record. Okay. These records are being used even in courts as evidences so that to protect the performance of professional responsibilities of nurses and basically to represent the institution or hospitals or any facilities pertaining to the protocols in the prevention of errors. And that is what we call quality assurance. In quality assurance, there's a need. That's why there are many forms, records, filing, because again, this will protect not just only yourselves, but it will also protect your patients. We are advocate of patient safety, and we must be an advocate of their welfare. And documentation could be part of our professional responsibilities. Second, right evaluation. If we're talking about right evaluation, we are considering the fact that you continuously consider on how you will take part at the start of preparation of the drug and at the time that you have administered the drug and at the time that the patient's reporting on adverse reaction took place. Right evaluation could give independence and confidence to our nurses. We can discharge our responsibilities in holding the drug or discontinuing the drug. Why? If we assess the patient, which is number 3, if we assess that the patient could be at risk of adverse reaction, the nurse may not wait for the doctor's order. The nurse may have clinical decision to discontinue the drug because basically it is part of a responsibility that the patient may not develop any complication as cause or secondary to effects of medication. So that's basically right evaluation. At the time that you took the vital signs of the patient, it already gave you it already gave you the right to handle the situation, the independent function to decide. And particularly, particularly these are situations by which nurses will monitor and help and assure the patients, not assure, but uh, have a trusting relationship with each other that the patient will report any of the adverse reactions, even side effects, because the nurse may need to consider if these are prolonged side effects, because possibly this could consider uh, a possible adverse reaction. In the perspective wherein the right evaluation is being considered, this has also an implication to the number one, which is the right documentation. So other than that, um, the right evaluation may consider if the drug is not taking into effect. For example, if the patient has this discomfort with uh, has the discomfort pertaining to the side effects. It's particularly, it's not just only discomfort, but mainly these are suspecting for the what we call adverse reaction. So I think that this clinical decision making of the nurse is to mainly refer it to the doctor, because possibly doctors may change the brand of the drug, or possibly may change totally the drug into another classification of drug. So the nurses who are in the front line has a major responsibility when it comes to administration of drug. Next, right assessment. On the right assessment, what are the basis or data that you may consider that you are performing the right assessment? First and foremost, patient history is very important. Okay? Because mainly on the on the on the references of if the patient has history of certain disease, okay, certain diseases that will counteract the effect of the drug, how it will counteract. Again, we have talked about indication and contraindication. It means indication is the drug is intended for certain conditions, and contraindications, the drug must not be given to these health conditions. Example, there are some drugs that must not be given to pregnant mothers because this may cause a possible complication to the well-being of the fetus. So I think a right assessment could help when we are aware of the patient history. Again, hypersensitivity reaction. If you are aware and you have considered specifically the knowledge, the skills that you have acquired and learned on the signs and symptoms of hypersensitivity reaction or allergic reaction, your right assessment will lead to a clinical decision making to withhold the drug or discontinue the drug or will not administer the drug. That's why very important to do skin test, as what I have reiterated in our last slide, because skin test will give us the idea to withhold the drug and not risk to administer the drug, because again, any allergic reaction of the drug could be accountability of the nurse, because one of the questions that doctors and the healthcare team may raise: did you perform assessment to your patient? Did you ask the patient of any allergic reactions or hypersensitivity? Have you done skin test? Then you need to answer them back if you perform all of this and it's part of the right assessment. Number four is right reason. Okay, for the right reason, we're talking about why the drug is being given to the patient. Again, I have already reiterated to all of you that drugs cannot be cannot just be administered to patient without any explanation at all. Nurses, future Centralino nurses, it's very important for us to discharge our responsibilities. And since we have established rapport with the patient, then the patient has the right, whatever care she received. I know that you may have the confidence and competence to perform the task, but the patient, as a layman, deserve to know what she is receiving as part of our care management. The classification of the drugs may simply consider your reference to best explain the purpose and the reason. Second is particularly when we are talking about the uh indeed the why, or rather the mechanism of action. Okay, the mechanism of action is uh being considered as well as uh particularly being considered as well particularly when there are some uh situations or decisions that if the patient consider refusal of the drug, then you must consider further explanation or reason why she really need to take the drug. So I think these are expectations for nurses. That's why your pharmacologist has been integrated in the curriculum, because these responsibilities are very basic, and you must take it seriously. Next, we have discussed this number 6, the right time and frequency, because of its implication when it comes to, again, bioavailability, the 100% effect of the drug, and the 50% the half-life of the drug. Number 7, the right to refuse. When it comes to the right to refuse, again, the patient may have the right, but nurses have the responsibility to convince the patient of the purpose of taking the drug. I know for a fact that all of you will definitely suggest, okay, if the patient will refuse, just prepare the waiver. Okay. Don't give them the option, because probably this patient, if they are inconvenient, if they will experience discomfort in relation to that drug administration or medication administration, they will always consider refusal because we have the waiver, because it could be their right. But I think, on the perspective of how the nurse will discharge her professional responsibilities, I think the best way is first, okay, we could consider a waiver if the patient was not convinced, if the patient was even with in coordination with the doctor. Second, the one that must be considered is to best explain that whenever the patient refused the drug, what could be the possible complications? What could be the expected action and the purpose why the drug is being given with her condition. Third is we may need the help of relatives, so that to have a strong support to convince the client to take the drug. So whenever the client may have refusal of taking the drug, let us still consider nurses will have the responsibility of why we administer the drug. And we may not consider at all times the option that, okay, the patient has the right to refuse and we could have the waiver. So, okay. So, will you consider this situation to be referred to the doctors? The answer is yes. If so that the doctors may have the option, or the healthcare team may have the option on how to facilitate continuous care and treatment regimen to the patient. 9 or 8, right route. So this has been elaborated in our previous discussions. Next, we have the right expiration date. There are questions that had been addressed, okay, that had been addressed at the time of the at the time wherein we have considered the perspective of the uh for example, sir, if I have received an expired drug, what will happen? Okay, let's go back to our discussion. There are two major organs that are responsible for the metabolism and excretion. Okay, there could be a preventive way that the body will compensate to prevent toxic effect, because again, an expired drug may lead to toxic effect. So again, there must be a healthy liver, a healthy gut, and a healthy kidney, so that to facilitate metabolism and excretion of the drug. Because any expired drug may cause a possibility of either toxic effect, or either, if it may not have physiologic effect, the patient just took the drug, and we may not expect that it will reach desired and therapeutic effect, because it lose already the potency. Remember, when the drug reaches expiration date, it lose already the potency. It means that the drug may not take effect in the body. More so, this may cause a possibility that it may lead to a possible toxic effect. So still, the patient with expired drug may lead to a possibility of what? Of risk with safety. Next, 10, right education. Nowadays, there are presence of the social media which may cause a possibility of misinformation or false information that they may access. And since you have already established rapport with your patient, the trust must be maintained in such a way that the existence of a nurse must be felt by the patient. So if if the if the competencies that we discharge in our responsibilities in relation to drugs are being felt by the patients, I think they could comply. Education may not just only considered as a role at the time of hospitalization, but even when the patient will be possibly or will be subjected for discharge. Then at home or when they go back to their communities, patients may not be at all times with nurses. So that's why we need to empower them. We need to have high independence for them to decide on their own. They could still refer to their doctors, but again, there are possible limitations that they may not access. So they really need to be empowered so that they may have high independence to decide if it will already risk their lives in relation to medication. So that is the way that is very important with the right education. We considered the number 11 right drug, and we've discussed the importance of having the right dose. Again, before we proceed to the next slide or the topic, if you have any question, the chat box are open for any questions, inquiries, or if you wish to share any of your experiences, your lived experiences in relation rather to these 12 rights of medication, feel free. The floor is yours. If none, can I see thumbs up again so that we could proceed to the next topic? Can I see thumbs up if I can proceed to the next topic? If the topic that had been discussed on this slide presentation is clear, thank you so much. Okay, let us continue with the next slide. It is very important to consider that as nurses, we have common medication suffixes. Ayan. This is what I am talking about. When we talk about suffixes, this could be your guide, okay? This could be your guide for you to identify classification of drugs even though you may not memorize all of these drugs. Okay. Again, remember with with the with the drugs and medications that you may encounter in professional practice, you may possibly remember it if you frequently encounter it. But again, you may not memorize all of these drugs. But certainly there are ways on how you can remember and classify those drugs through the use of common medication suffixes. On the table, the left column is referring to the suffixes. The right column is referring to examples, okay? Examples of drugs that could be under the classification on the left column. So let's start. When we talk about suffixes such as cane, okay? Cane. Any drugs ending in cane such as lidocaine, bupivacaine, lontocaine, pontocaine, um, rosucaine, bupivacaine. These drugs, even though with different names, but ending in cane, except for sugar cane. Okay, just kidding. Okay, those are particularly considered as anesthetics. Okay, cane, lidocaine is considered as local anesthetics. Bupivacaine and lontocaine could be used for spinal anesthesia or general spinal anesthesia because anesthesia could be by intravenous or via inhalation. But this cane could be intravenous or it could be via spinal, epidural. Okay. So now, if we say, okay, just to give you an overview, what are anesthesia? Anesthetics are being given if there will be a loss of sensation. Okay? A loss of sensation, but not mainly loss of consciousness. Kasi sometimes if we perceive it anesthesia, okay, anesthesia, it will cause loss of consciousness. Okay, ha? If we say local anesthesia, from the term itself local, the anesthetic effect will be on specific area only. For example, if the patient will undergo a surgery that is particularly on a specific area, such as breast, okay, the breast mass. If there will be removal of mass, the anesthesia will be introduced on that area where the mass is being located before it undergo the procedure. So, lidocaine are being used. Even during circumcision, the anesthetic has its only localized area are the ones being anesthetized. Dental procedure, anesthetics are being given and it will cause only anesthetic effect on the specific area only. So those are local anesthesia. If we have spinal anesthesia are anesthetic effect that will have abdominal and up. Okay, ha? Spinal anesthesia, anesthetic effect of waist up. Okay, general anesthesia are anesthesia that will particularly consider the whole body. Now, if we say ano sir, spinal anesthesia, have you heard about painless delivery? Normal delivery pero painless. That means that the pain when the patient will deliver and will cause the possibility of the the pain, tolerable ang pain for spinal anesthesia. That's why it is called as painless. But particularly there will be the nurse will basically consider its role whenever there will be uterine contractions. The coaching of the nurse is very important for the patient to bear down. Okay, to bear down. So spinal anesthesia will only consider abdominal surgeries. Okay, then other than that, for major surgeries, usually it's general anesthesia. So anything that is cane. Probably you may ask, how about sir cocaine? Okay, ha? The drug ends in cane. Or rather the word ends in cane. Actually, the cocaine particularly are now being studied, 'di ba? In some other countries they are using it as a medical treatment specifically for pain. However, here in the Philippines, we can't consider this as legal because we don't have any law that supports its regulation, particularly on the use of cocaine. But again, since it ends with cane, then it is regulated. Okay? And not yet being used here in the Philippines for medical treatment. So that's why there is a need for a law. So, sir, are these anesthetics can be purchased over the counter? Definitely not. Definitely not. You need the prescription of the doctor. Moreover, you need a prescription with S2 license. S2 license are very important. Remember this ha, whenever you will be assigned in the operating room. S2 license, even the hospital ha, even in the hospital, they cannot purchase anesthetics without the S2 license. S2 license are prerequisite for the institution or individuals to purchase anesthetics because these are being regulated. If the prescription do not indicate S2 license of the physician, most of the manufacturing companies, even pharmacies, will not dispense drugs without S2 license because there's a need to do regulation of this drug. Kasi alam nyo naman po that any of this drug, once administered intravenously, may cause the possibility of direct effect to the brain. that will cause the risk of individuals to fatality. Okay. And subject possibly for abuse. Okay? So next, if you encounter drugs ending in "done," yan, ending in "done." If you encounter opioid analgesics, narcotic analgesics, opioids. Okay, opioids. Let's start with the term analgesic. The term analgesic are being used for pain relief. Okay? Now, if you encountered narcotic analgesics, drugs that is indicated for pain, but the drug has a direct effect to the brain to control motor response. Kaya usually these drugs may cause dizziness. Okay? Because direct. Ang ginagawa kasi ng mga narcotic analgesic, ini-slow niya yung impulse transmission, yung electrical impulse, so that ma-prevent or ma-block yung response ng pain, yung motor response ng pain. Kaya that's why if you've heard about opioids, wait, opioids, di ba nakakasama yan, opiates. Nakakasama yan particularly sa listahan ng regulated drugs, substance abuse, definitely yes. So similar also with anesthetics, these drugs are regulated and it cannot be purchased easily in some of the pharmaceutical companies or even by institutions without the S2 license. One of the consideration that you need to, since direct sa brain yan ang effect ng pag-hold ng motor response ng pain, ang most pagka nagkokos ng overdosage ng narcotic analgesic ay nagkokos yan ng respiratory arrest. Kasi sinosuppress niya yung medulla oblongata, which is responsible for our respiratory function. So pwedeng pag nag-overdose ang pasyente ng narcotic analgesics, may lead to a possible loss of consciousness kasi sabi ko nga sa inyo, ini-slow down niya yung impulse transmission. And another is that of one that could be affected is the respiratory function. So ano yung mga example ng opioid analgesics ending in "done"? Hyd 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 ano 'to? Hydrocodone, oxycodone, methadone. So anything na ma-encounter nyo ending in "done." Example, mesamodone, cytodone, tintodone. So remember, generic we're talking about generic name. If you encounter "done," these are opioid analgesics. Okay, opioid analgesics are being given pagka mga severe pain na. Usually brought about by serious injuries or major surgical operations, which pain is not anymore tolerable by other medications. Okay? So again, the chat box are open. So there are some students who have been disconnected. A while ago, we are 31, but we are now 29. So meaning we miss, if we are 31 then we miss 2 students who had been disconnected. Anyway, so another is if you encounter a drug that ends in mycin. Okay? Mycin are antibiotics. Okay? Antibiotics po. What do you mean by antibiotics? Antibacterial. So the term itself anti is it already inhibit. Okay? It prevents. It counteract. So ibig sabihin antibacterial, it inhibits the growth of bacteria or microorganism. Mycins usually are being used particularly on certain type of infections brought about by bacteria. Kaya nga siya antibacterial. However, if you go back to the concept of your microbiology and parasitology, di ba we have gram-negative and gram-positive bacteria. So, may mga drugs tayo that can only combat gram-positive or gram-negative bacteria. Kaya that's why I even reiterated to you before na always consider that we have concerns really on antibacterial resistance. That's why avoid self-medication because this will cause the possibility that your body may not adapt anymore, may not adapt anymore on the effect or the side effect of the antibacterial. So, usually itong erythromycins are being given to patients with tuberculosis, which is caused by tubercle bacilli. Clarithromycin, these are drugs being given for any infections in relation to gastrointestinal. Azithromycin, if you're familiar with azithromycin, these are the drugs commonly prescribed at the time of COVID-19. Question, sir. Why is it we are being patients with COVID-19 are being given with azithromycin and yet COVID-19 is viral? Okay? Viral or virus. Now, we have the so-called in pharmacology prophylaxis. If we say prophylaxis, these are drugs that will prevent existence of the type of infection. Similar as, kung for example, di ba when during floods, di ba during floods, you are being educated or don't immerse yourselves in floods. Moreover, if you have open wounds, because possibly there could be an entry of infected urine of rats with leptospira, and that may cause leptospirosis. So some of the doctors are prescribing doxycycline so that to prevent preventive na siya for the leptospira to enter the body. Moreover, if you are vulnerable already, that you have open wound and you immerse yourselves in floods. So, dissimilar also at the time of the peak of COVID-19, doctors have administered azithromycin for preventive measures, meaning to prevent any bacterial infection. Kasi remember, at the time of COVID-19, we have identified individuals who have been, who have developed and diagnosed with complication of pneumonia, and those are bacterial. The production of secretions could be brought about and triggered about by bacteria. Okay? However, if if you wish to consider, ito naman yung consideration, that if you are just only giving drugs that will combat only gram-positive bacteria, the minority of the microorganism is the one that will multiply. So, that will dominate naman specifically to cause infection. That's why some of doctors are giving broad spectrum antibiotics. What do you mean by broad spectrum antibiotics? The broad spectrum antibiotics will combat both gram positive and gram negative bacteria. So, yun yung higher level of antibacterial that will combat most and majority of gram-positive and gram-negative bacteria. So, meaning you are already preventing both. You are inhibiting both minority or dominant microorganisms. So, that's why in this perspective, we are considering the point that the patient may take a drug that may have what? That may have a suffix of oxacin. O, familiar kayo with oxacin. Okay? Oxacin, levofloxacin, ciprofloxacin, norfloxacin. So those drugs ending in oxacin. So again, if you encounter a drug that is broad spectrum antibiotics, these are drugs that may inhibit growth of bacteria, gram-negative, gram-positive, and other types of bacteria. Okay? However, remember, Pag mga highly concentrated drugs, broad-spectrum antibiotics are examples that may possibly risk, okay, may possibly risk damage of kidneys and liver. So that is basically the sad part. That's why the nurse must be responsible to assess if the patient is at risk, if the patient has existing diagnosis, or if the patient has history, certainly on reactions of broad spectrum antibiotics such as oxacin. Do you know po ba that oxacins are also being given to patients during the time and peak of COVID-19? Again, for purposes of prophylaxis or for those who have already developed and have signs of pneumonia. These are the drug of choice, the oxacin. However, you need to monitor the effect of this drug specifically on the effect to the liver and kidneys. Next, if we're talking about bacteria, which are antibacterials or antibiotics, we are now considering viruses, antiviral. Do you know that even during the time of COVID-19, there are drugs that are being given as antiviral? Those drugs are ending in vir, if I'm not mistaken, monoclovir. Yan, very prominent drug yan that were administered during the peak of COVID-19 in Lung Center of the Philippines. Because vir, so you might think it's a suffix of vir, then we have antiviral. When the patient also encounter chickenpox, chickenpox is a viral infection, right? It's a communicable viral infection. However, to prevent complications, to prevent severity of the viral infection, some of the patients, actually in chickenpox may not need any of the drugs mentioned. Pero for purposes of response, of immediate response, aside from the normal response of the body, patients are being given antiviral. So ano yung common yon? Acyclovir, apaclavir, adepovir, drugs ending in vir. B-I-R. Okay? Next classification or next suffix that we will consider are drugs ending in dine. Okay, din. Okay, ano po ibig sabihin din? D-I-N-E. Okay, D-I-N-E. Meron tayong tinatawag when the patient experiences hyper acidity. I myself experience it. And I'm sharing with you because I do not have any more gallbladder because I undergone a cholecystectomy due to the presence of gallbladder stones and the possible risk that the continuous gallbladder stone may block the hepatic duct. So that's why I undergone cholecystectomy. Kaya as an advice, please manage your diet with fatty foods. Okay? Because those fats that could be stored in your gallbladder may risk to formation of stones. Okay? So during those time that I'm experiencing cholelithiasis, so when you encounter lithiasis, formation of stone, at the time that I encounter cholelithiasis or formation of stone in the gallbladder, one of the functions of the gallbladder is to synthesize fats and cholesterol, or the temporary storage that will be synthesized at the time that enzymes are being released during the time of digestive activity. Now, at the time that when I will have when I will experience a pain because of the presence of the stones, um I experience also indigestion. So meaning my digestive activity are very slow because enzymes are not sufficient to break down food during digestive activity. So it causes pain and may cause possible hyperacidity. And that's the time that it will induce vomiting, it will cause epigastric pain, that's the epigastric pain, and increase in the acid reflux. So that's why those drugs initially that have been given to me, because hyperacidity, what contradicts or counteract acid is basically base or alkaline. Most of the alkaline drugs, alkaline-based drugs, are those drugs that have aluminum and magnesium in the generic name. There are known brand names dyan. Maalox could be one. Sa mga gastroesophageal reflux disease, yan yung mga Gaviscon. Yan, those may have alkaline-based component of drugs. And you can see it in the generic name. However, remember this, when you're administering a patient with hyperacidity and at the same time experiencing diarrhea, okay ha, as a response of the body, never give, never ha, remember, never give a drug that has a generic composition of magnesium. Why? Because it may further trigger diarrhea. Another, if the patient is having hyperacidity and at the same time has constipation, never give an alkaline-based drug that has aluminum because it will further complicate problems with constipation. So remember those remember those reminders. And other than that, if these drugs will not reach its desired effect, we will proceed to a higher level of drug that will manage hyperacidity. And these are DIN. Kasi alam po ninyo, if it will continue the increase in the hydrochloric acid level, remember acid. Acid may cause irritations. And acid may cause irritation of gastric lining and possibly may lead to ulceration. Pag nag-cause yan ng ulceration, it may cause damage to the skin, or rather, it may cause damage to the gastric mucosa and possibly may lead to bleeding. Ulceration pa lang mahapdi na when there is increase in hydrochloric acid. So that's why we need to have a higher drug, which is the DINE. These are H2 or histamine blockers. Okay. I mentioned to you about beta. These are impulse transmitters to give signal for the heart. Ang histamine 2 naman, remember, histamine 2 is for the stomach. And that will facilitate to the gastric cells to secrete hydrochloric acid. So, etong mga din na to, ranitidine, famotidine, cimetidine, lahat ng drugs ending in tidine, tidine, are H2 blockers. Now, sir, paano po pag hindi pa rin na-manage, if it does not reach its purpose of hyperacidity, meaning we need to again have another alternative drug. Drug that will already consider the holding or rather the function of secretion of hydrochloric acid. So direct na tayo sa cell, hindi na tayo sa impulse. We may have proton pump inhibitors. Okay? Proton pump inhibitors ay manage the control of the cell to prevent secretion of hydrochloric acid. Ang proton pump inhibitors are drugs ending in prazole. Take note of that, Those drugs ending in prazole. What are those? Omeprazole, lansoprazole, esomeprazole. So any drug na may encounter ninyo by the generic ending in prazole, okay, ending in prazole are proton pump inhibitors. Okay? So I think we have reached 5:30, and as promised with our class schedule, we will resume and we will have first health break. Again, before we have our health break, are there any questions, any inquiries, any clarifications before we continue after 15 minutes? If none, can I see thumbs up from our students in this online class? Okay, so we will have first the health break for 15 minutes. Hydrate yourselves, Stretch your extremities so that it will facilitate circulation for good oxygenation as you absorb our learning session. And as what I have mentioned, attend to your physiologic needs. Okay? So we will be back after 15 minutes. Thank you very much. So again, we will continue our discussion and resume our topic on our topic common medication suffixes. We ended up with the discussion on suffixes such as cane, done, mycin, oxacin, vir, and dine or din, tidin. We may now continue on those suffixes that ends in lam or pam. Any drugs that ends in PAM could be considered as anti-anxiety agents. Sometimes they may have classified this because most of the drugs that ends in PAM, such as diazepam or Brandemis Valium, had been associated with pain management. Moreover, those PAM and LAM as anti-anxiety agents may facilitate specifically for anti-anxieties. So, examples are lorazepam, the known diazepam or Valium, clonazepam. So, these are anti-anxiety drugs. For situations like there are diseases that may certainly consider uncontrolled movements or involuntary muscle movements, those situations are happening with Parkinson's disease. And that's why there are drugs that may basically consider the control and blocking of the uh, nerves for muscle contraction so that to facilitate not to facilitate involuntary or to control involuntary movements are those drugs ending in nium, N-I-U-M. So those drugs that ends in nium, examples are pancuronium, becuronium, rocuronium. So any drug ending in nium, we are referring to ano ha? We are referring to the generic name ha. So next po, we have discussed a while ago about drugs that are being given once a day and chances that may consider the factor of cholesterol. Again, we have the what we call lipoprotein that encapsulates the fats and cholesterol that facilitate its transport via plasma. And those that may consider possibly the low density lipoprotein may cause a dislodgement in blood vessels and soon may cause obstruction. So facilitate the effective synthesis of this cholesterol that are usually given at night or before sleep once a day are those drugs ending in statins or statins. If you are at home and if you will try to check some of the medications of your parents who are known hypertensives, they are usually taking these statins or anti-hyperlipidemics, or in some other drug handbooks, these are anti-hypercholesterolemia. Now, examples are simvastatin, rosuvastatin, fluvastatin. So again, statins. All drugs with suffix ending in statin. Okay. In this drug, statins, um one of the things that you need to consider for monitoring is liver function. Kasi statins are known as hepatotoxic. Kaya we need to take into consideration the function of liver because this may cause its possibilities. So nurses need to monitor. Next, other than statins, so if ever you find it that our discussion is very fast and unclear to you, you may just raise your hand or unmute yourselves or post a message in our chat box. Next, we have IDE, drugs ending in IDE or IDE. IDE are drugs considered as oral hypoglycemics. What do you mean by oral hypoglycemics. So definitely this drug manages problems with hyperglycemia. What do you mean by hyperglycemia? Hyper, increase, glycy, sugar, emia, blood. So increase blood sugar. For those who may encounter or situations that may have increased blood sugar, or we all know that diabetes are considered as or has been considered as chronic disease. To monitor the control of blood sugar, oral hypoglycemics are being prescribed. Drugs ending in IDE, glimepiride, glipizide, glyporide, anything that ends in IDE. Next, let us proceed to drugs ending in zone S, O, N, E. Any drugs ending in zone are considered as steroids. And steroids are anti-inflammatory drug. Usually, if the patients are having diagnosis such as with itis at the end of the diagnosis, bronchitis, nephritis. So itis are suffix that considered a problem with inflammation. However, steroids are not advisable to be taken in long period of time as maintenance because this will cause kidney damage. Now, if it will cause if it will cause kidney damage, this may cause the possibility that it will manifest facial edema. Class, remember pag nakikita ninyo yung facial edema or minamanas na ang mukha, usually 'di ba I mentioned to you that most of the edema may happen or may exist sa foot. Yung tinatawag nating pitting edema or manas because of gravity. But once the patient have already facial edema, the next thing to do is to check for functions of kidneys. Ngayon, steroids, we have natural steroids sa body. Ang concern dito is that pag yung natural secretion of steroids, then we have the steroids that are being administered to patients simultaneously. Doon na siya pwedeng mag-cause ng particularly the natural source with the drug supplemented ay mag-a-act din sa kidneys. So that's why this could really cause nephrotoxic. Steroids must be taken also in full stomach. Why? Because steroids may cause irritation to gastric mucosa and may lead to gastritis or ulceration. So take note of that. Any steroids that are being taken orally must be on full stomach. However, I know that probably you may ask if drugs, sir, steroids are also being administered intramuscularly for those who are uh, engaged into workout. Again, when steroids are being given intramuscularly, these are not the appropriate way of administering it. That's why there are no scientific studies that this could be for that indication. And some have discovered that this could facilitate additional mass to the muscle, then this could be risk and may lead to possible danger to individuals who are doing injectable steroids. So going back to steroids, dexamethasone, usually these are given to patients na may mga inflammation sa tissues, sa heart, sa brain. Hydrocortisone, usually this zone are being given sa mga inflammation that are identified in the respiratory tract. Betamethasone, this is the drug that are being given sa patients or rather sa premature possible premature labor or preterm labor that may possibly cause premature delivery. Kasi if there will be premature delivery, betamethasone is being given sa mother para mag-secrete pa ng surfactant ang lungs para once the baby will be out, this will cause the facilitation of effective lung expansion. So sa mga premature, betamethasone are being given to secrete surfactant. Now, let us now proceed with drugs ending in "zide". If drugs are ending in "zide", dalawa kasi yan "zide" at saka "mide". Now, if we're talking about "zide", thiazide actually, thiazide actually, we have in particular po specifically on the diuretics. Sa diuretics po ay usually if ang reason of why there is diuresis, these are being processed by our body to facilitate micturition or urination. Now, in this perspective, if there will be retention of fluid sa body, ano ba yung mga situations na nagkakaroon ng excess fluid sa body or retention? Pag may enlargement of the heart, if may fluid sa lungs, if there are enlargement of organs, yaan. Diuretics are being administered so that to remove excess fluid of the body. At ito po ay nagmamanifest as what I have mentioned sa inyo through pitting edema. So, edema that cause accumulation of fluid sa tissues. So, yung tawag natin doon, manas. Iba yung maga sa manas in colloquial. Maga, there is inflammation of tissues and may lead to thickening. Ang manas po, there is inflammatory or there is swelling, but the swelling is caused by accumulation of fluid. Kasi usually what happen, if we have excess fluid sa blood vessel, it will cause shifting of fluid from intravascular, it goes out of the blood vessel, pupunta yan sa spaces. Pag nagpunta yan sa spaces ng tissues, ayun, doon na nagkakos ng pitting edema. So that to facilitate removal of excess fluids, then diuretics are being given. Ang risk naman when you're giving diuretics is this may cause the possibility of what? This may cause the possibility of too much naman. Kasi magkokos ng ano mag-i-induce siya ng urination eh. So the volume of urine that could be voided is possibly mag-cause ng dehydration or fluid loss sa patient and possibly may lead to electrolyte imbalance. And usually the electrolyte imbalance that we encounter with diuretics are problem with potassium level. Kaya careful pag kayo nurse who are attending to patients taking thiazides or mide, you need to monitor first if merong result of potassium level. Second is kung nag-i-increase yung weight niya in 24 hours. Kasi the increasing weight of patient within 24 hours is an indication of retention of fluid. So, ibig sabihin, the kidneys are not working in removing, in facilitating excretion. So that's why we'll need a drug that will facilitate excretion because the kidney is not working. So, but the risk is that of the amount and volume of fluid that are being voided may exceed to the supposedly volume and may risk the patient to dehydration. Next, so ano yung mga example natin? Sa Zide, chlorothiazide, hydrochlorothiazide, methylchlorothiazide, so thiazides. Thiazides. Pag mide naman, furosemide, torsemide, mide ang huli. Okay, mide ang suffix. So, class, these are just overview of those suffixes that you may also encounter in our succeeding discussions. Next, we have the drug ending in "pril". Okay. Etong mga drugs ending in "pril", these are antihypertensive drugs. Captopril, isinopril, enalapril. So drugs ending in pril by generic are what we call ACE inhibitors. Sir, anong ibig sabihin ng ACE? ACE stands for angiotensin converting enzyme. Okay, sir. So let's go back to a let's go back, sir, to a follow-up question. Ano po ba yung angiotensin? This is now the mechanism of what is happening. If there is hypertension, if the patient experiences hypertension, the other organ that will be triggered to assist in regulating blood pressure are the kidneys. So in the kidneys, we have adrenal glands. Adrenal glands will release catecholamines. And one of the catecholamines ay epinephrine or adrenaline. When it releases the adrenaline, it will give signal to beta 1. And that will cause to help the heart contract because of hypertension. Pag ang heart nag-contract through the help of adrenaline, that will facilitate prevention ng continuous increase of blood pressure. However, sa pag-secrete ng adrenaline ng adrenal glands, nagsisekrete siya ng tinatawag nating nagko-convert sa angiotensin 1. Alam nyo po, ang angiotensin 1 po ay pwedeng mag-cause ng constriction ng blood vessel of kidneys. So, ibig sabihin, automatic, nagko-cause yan ng constriction of blood vessel. So, ano dapat yung pigilan? Lungs are releasing enzymes kung bakit nare-release or nasisikret ang angiotensin. So, what we can do is to have a drug na i-control, that will definitely control and block po at inhibit yung enzyme. And that is angiotensin converting enzyme, the enzymes being released by the lungs. So, ano ba yung problem, sir, pag mag-constrict ang kidneys or blood vessels of kidneys? So, let's go back to the physiologic response of kidneys to the lung, to the heart. Kidneys regulating the blood pressure. So, automatic, the kidneys are the ones will regulate blood pressure. Ngayon, yun na nga, in the process, yung enzymes will convert sa angiotensin 1 na pwedeng mag-cause ng harm sa kidneys. So, yun yung iniiwasan natin. So, that's why we have those drugs. So, ano itong mga drugs na to? Drugs ending in pril. Next po, the last two drugs we are talking about sa medication suffixes. The last two drugs are pin or amyl. Actually, yung amyl, verapamil, isa lang naman yan. But the other one is dipin. Actually, dipin yan, hindi pine. Para mas ano. Yung isa tidin ha, ito ay pin or dipin. Calcium channel blockers. If we talk about calcium channel blockers, please explain further, sir. Ano problema ng calcium? When the blood vessels, for example, let's go back to the cholesterol. When the blood vessels will have obstruction, then supposedly the blood will have continuous flow. When supposedly the blood will have continuous flow, doon nagke-create ng overstretching of the blood vessels. Pag nag-overstretch, if it will cause overstretching of the blood vessels, nai-irritate yung endothelial lining, yung pinakaloob. If it will cause irritation of endothelial lining, mag-irritate, then mag-inflame. Pag nag-cause ng inflammation, pwedeng mag-cause na yan ng ulceration, mag-bleed. Ngayon, ang problem, pag bago yan pag nagko-cause na yan ng inflammatory, etong si calcium ay automatic will compensate. Release of calcium para mag-dilate at tumulong sa blood vessel to facilitate circulation. But the problem is that of the more po na nagki-create ng pressure sa blood vessel, the more then ang calcium ay masisikret. The problem is that of when there's excess calcium secretion, doon na nagko-cause ng tinatawag nating decalcification. If we say decalcification, it will cause hardening. It will cause hardening of the blood vessel. If it will cause hardening of the blood vessels, this will cause the problem, another problem. So katulad kanina, we cannot control the release of the enzyme. Kaya yun ang dapat i-control. Ang calcium automatically will be released to help those blood vessels that could be endangered for inflammation. Ang problem naman, if it will continue or excess ang calcium release, may cause decalcification. So magkukos yan ng hardening of the blood vessels. So that's why we need to control, we need to block the calcium channel para continuously mag-secrete ng calcium. So those are dipine. So these are antihypertensive drugs. Ito, mga common drugs din ito na for sure some of your parents, relatives, grandparents are taking to control blood pressure. Ang mga common yan, yung mga amlodipine, simvastatin, yan, mga common antihypertensive drugs. Other than that, these are drugs that I always set an example to all of you. Yung olol, beta blockers. For example, a patient has hyperthyroidism. Increased thyroidism, thyroid hormone. Pag hyperthyroidism, ang effect sa metabolism yan, increase din. If there will be an increased metabolism, what happen? Lahat din itong mga itong mga impulse transmitters na ito ay increase din. Example, beta 1, increase din yung ano niyan. Increase din ang stimulation niya. So mag-increase ang heart rate. So ang histamine 2, kung halimbawang may increased metabolic activity, mag-increase din ang hydrochloric acid production. So that's why when we talk about olols, these are basically beta blockers kasi we are focused on the heart. Usually, ang patients may hyperthyroidism or goiter ay nagpapalpitate. And palpitation is definitely a sign na posibleng ang heart is too much working. The heart is forcefully working and contracting that possibly may cause increased oxygen consumption. So obviously, just typical for an individual who is engaged into physical activities, di ba you pause for a moment because you're running out of oxygen. You're running out of breath because that's the time that you really needed to support and regain oxygenation. So similar for the beta blockers. If the heart will continuously contract, there's a possibility that it may lead to shock because the heart is not refilling any more blood and thus may cause the possibility of cardiac arrest. So in that situation, pag nagkulang ang oxygen, kailangan natin, ang purpose dito, i-block si beta 1 so that to slow down the forceful contraction of the heart so that it may not increase oxygen demands. So one of the nurse's responsibilities here is to check for vital signs, ha? Vital signs. Kasi alam po natin that this may cause the possibility that the patient could be high risk of toxic effect. So most of the side effects of olols are bradycardia kasi specifically bababa talaga ang cardiac rate pero it's only temporary, ha. Hypotension, these are side effects. Ngayon, if these are side effects, dapat it must not prolong. While the drug is being given or administered to the patient or taking its effect, continuous monitoring of vital signs is very important. Kasi continuous bradycardia pwedeng mag-lead into shock. Pwedeng mag-lead sa cardiac arrest. Hypotension may cause continuous dropping or deteriorating of the patient's condition pag suddenly biglang bagsak naman ang blood pressure. So these are the responsibilities of nurses. So that's why common medication suffixes are very important. I am introducing this to all of you to have an overview of the importance of drugs on what are those strategies that can be considered to be familiarized with drugs. So to continue with our discussion, it is mainly considering the pharmacodynamics. Okay? Now, pharmacodynamics, we have mentioned about biochemical and physiologic changes. And I even mentioned to you any reactions of drugs, side effects, adverse reactions, these are commonly what? Commonly identified in pharmacodynamics. So this could be another way around on how you will, aside from suffixes, this could be another way around on how you will uh, classify the drugs. Okay? So, dun tayo sa receptors. Okay? Stimulate receptors. Pag sinabi nating agonist, it stimulate receptors. Example, what are those receptors that we mentioned? Histamine 2, yung mga familiar tayo. Histamine 2, beta 1. 'Di ba? Pag sinabi nating receptors, it will facilitate transmission of impulse. Kaya pag nakadinig tayo ng histamine 2 agonist, ibig sabihin, ini-stimulate natin yung histamine 2. Okay? Pag sinabi natin, if we say other than histamine 2, beta agonist. Okay, pag sinabi nating beta agonist, ini-stimulate yung beta 1. Next. On the other hand, the opposite of agonist ay antagonist. Okay. Similar ito sa mga terms being used as inhibitors, blockers, ayan. Ang tawag diyan antagonist. This is similar sa mga this is definitely similar sa mga movies. Pag nakakadinig kayo ng antagonist, they are the villains, the kontrabidas. So kinokontra nila. So, example, let's go back to the beta 1. Beta 1 antagonist. So, ibig sabihin, it inhibits, it blocks beta 1. Pag ginamit natin yung word na antagonist. Pag ginamit natin yung calcium antagonist. Ibig sabihin, it block or inhibit the it block or inhibit specifically the what? It block specifically the calcium stimulation. Now, if we are considering antagonists such as other than beta, beta antagonist, it blocks the beta 1. H2 antagonist, so it inhibits the histamine 2 receptors. So that is now mainly the agonist and antagonist. Now, I would want everyone po to take this seriously and have the mastery of parasympathetic and the sympathetic nervous system. I know this has been introduced in the anatomy and physiology. But again, I want you to be familiarized with this. Hindi lang just only familiarize, but basically you must have the mastery on this because this will basically guide you on how to identify drugs. Okay? Now, when we consider parasympathetic, sige sir, pag ang drug ay may parasympathetic effect, it follow through basically the effect in this organs. Pag ang drugs ay na-identified as sympathetic drug, ibig sabihin, these are drugs that stimulate sympathetic effect, which basically happens in all of these organs. O sir, let us have an example, ha? Let us have an example. Anesthetics. Most of the anesthetics are parasympathomimetic drug. Ano ibig sabihin ng parasympathomimetic? Mimic. Pag mimic, ginagaya, it mimics the action of parasympathetic nervous system. So, what you need to consider. So, if anesthetics is a parasympathomimetic drug, these are the effects ng anesthesia. And you will realize that nurses take into consideration responsibilities because of this effect. Example, alam nyo po, anesthetics may cause constriction of pupil. So once you check the eye, and it cause constriction, expect that this is brought about by the result of effect of anesthetics. Now, At the time of operation and when the patient is receiving what you call this, anesthesia, once it causes its effect, you need to take into consideration na nag-i-stimulate siya ng salivation. So ibig sabihin, kaya most of the time ang pasyente mo ay ang head niya ay pinuput on side because to prevent aspiration. Kasi there could be a tendency that the salivation itself, the too much salivation or saliva may cause the obstruction of airway passages. Next, most of anesthetics, after operation, you need to monitor the vital signs, specifically the heart rate and the cardiac rate, ha. Start every 15 minutes for the first hour. Second is you need to check every 30 minutes until 1 hour, then stable. What is that? Why is it is being monitored? Because when the drug or anesthetic will take its effect to inhibit the heart, so will there be a possibility na pwedeng mag-cardiac arrest yung pasyente? Yes, because of the continuous effect of anesthesia. Will there be a possibility that the patient will experience respiratory arrest? The answer is basically yes, because ang effect ng anesthesia ay magkukos ng constriction of airway passages such as bronchi. So nakuha po why we need to monitor vital signs post-operatively. Another situation, we always consider patient for operation to be NPO, nothing per orem. What is the reason why the patient may need not to have any intake when there will be induction of anesthesia or the patient will be subject for induction of anesthesia or operation. Why? Kasi anesthetic effects sa parasympathetic ay magkukos ng stimulation sa digestive activity. To what extent? Magkukos siya ng stimulation sa digestive activity. Pag nag-stimulate ang digestive activity, ano yung pwedeng mangyari? There will be a possibility na mag-i-increase din ng hydrochloric acid. Pag nag-increase ang hydrochloric acid, pwede yan mag-reflux in the upper GI at posible yan na pwedeng mag-cause ng vomiting or mag-induce ng vomiting. Remember, when a patient is under anesthesia, general and spinal, the patient is partially conscious. In situations that the patient cannot move by himself or independently, his actions or extremities as if it is a compensatory mechanism. Now, if the patient have taken meal, pulang stomach, induction of anesthesia, mag-i-increase yung hydrochloric acid. Pag nag-increase yung digestive activity at nag-cause yan ng vomiting, pwede ba yan na hindi mailabas ng pasyente at posibleng mag-aspirate yan papuntang airway passages? That is basically possible. At pag nag-cause siya ng possibility na mag-obstruct ng airway passages, pwedeng mag-cause ng arrest sa pasyente. Okay? So nakuha po ninyo yung perspective na if a drug has parasympathetic effect, you are now knowledgeable that the effect of the drug is on the parasympathetic reference. So kung halimbawa naman, eto naman ha, kung halimbawa naman, when you experience or when you encounter emergency situations and you are assigned in the emergency room, the patient will receive epinephrine. Epinephrine is considered po as sympathetic drug. Okay? Sympathetic drug po yan. So, ano ngayon ang effect ng sympathetic? So, since we need to consider po to revive the patient's cardiac status, and basically we need to revive the patient's condition in terms of the heart. Ngayon, ano po ang effect ng sympathetic sa gamot? Magre-relax yung bronchi so that to facilitate airway. Magkukos ng acceleration of heart so that the heart will facilitate contraction habang nagka-cardiopulmonary resuscitation. Other than that, ano pa basically yung dapat mong i-check? Pag ang patient mo ay such epinephrine is given, meron siyang sympathetic effect. So it means that when you check the eye, dilates pupil. Ibig sabihin because of the effect of epinephrine. Ang isa po dyan is pwede pong mag-dry ang oral cavity. So pag nag-cause ng dryness ang oral cavity, pwede pang maging risk yan for possible dryness of mucosa. Kaya yung iba, inaano yan, they manage it with cotton or any cloth with water so that to facilitate moisture. Other than that, pag sympathetic effect, ini-inhibit naman ang digestive activity. So, those are the situations na why kaya pag nagbigay tayo ng epinephrine, ayan nga, kasi pag nagbigay ka ng epinephrine, ang ini-stimulate mo ay ang adrenal glands para more mag-facilitate ng secretion ng epinephrine to help the heart to contract during cardiac arrest. So hoping po, I'm not hoping, but I am expecting that all of you will have the mastery on parasympathetic and sympathetic responses. What is the implication of why I am advising you to be aware, hindi naman memorize, to have mastery. Kasi pag memorize lang, after few days makalimutan na. But for you to familiarize, for you to learn this, for you to have mastery of this will really help you when you will encounter situations of administering the drug. So ito po yung binabanggit ko po. Okay? Kanina I mentioned po yung use of agonists and antagonists. Okay? Ngayon naman, we will discuss yung mga basic terms na related sa parasympathetic at sympathetic. So whenever you will encounter these terms, alam nyo na kung paano nyo to i-define. Even you may not anymore memorize it, you can just only analyze it using the agonists, antagonists, and those terms that could be associated with parasympathetic and sympathetic nervous system. Okay. Parasympathetic, okay, parasympathetic is also called as cholinergic. Remember that, ha? Sympathetic is also called as adrenergic. Adrenergic. So yung neurotransmitter, yung nagtatransmit ng signal para po ma-stimulate ang sympathetic ay norepinephrine. Ang parasympathetic po ay acetylcholine. Again, if we're talking about parasympathetic, we also called cholinergic. If we know cholinergic, the neurotransmitter is acetylcholine. For sympathetic, neurotransmitter is norepinephrine, also called as adrenergic. So ibig sabihin pala, sir, pag naka-encounter kami ng cholinergic drug, it means that the action of the drug ay parasympathetic. Okay? Pag nakadinig kami ng acetylcholine drug, ibig sabihin, parasympathetic. If we encounter norepinephrine enhancer, it enhance. Sympathetic yung effect. Pag naka-encounter po kami ng adrenergic drug, ang effect niyan po ay sympathetic. So let's have some exercises. Okay. Pag naka-encounter kayo basically ng parasympathomimetic drug, mimic, ginagaya, it means the action is parasympathetic. Sympathomimetic, ibig sabihin, mimic, it mimics the action of sympathetic drug, sympathetic effect. Next, pag nakaka-encounter kayo ng terms such as lytic, ano yung mga lytic na yan? Anxiolytic, mucolytic. Ang lytic po is a term na kinoconsider po as anti. Antagonist po yan, kinokontra. So what does it mean? Pag nadinig nyo po yung sympatholytic drug, ibig sabihin, ininhibit niya, kinontrol niya, or rather, kinounteract niya si sympathetic, ang effect niyan parasympathetic. Pag naka-encounter ka ng kinontra niya, lytic, kinontradict niya, kinounteract niya yung effect ng parasympatholytic, ang effect niyan sympathetic. Okay. Another is Pag nakadinig kayo ng cholinergic, obviously, associated yan with parasympathetic. Pag nakadinig kayo ng adrenergic, obviously, ano yan sa sympathetic. Okay. There are terms that are being used as anti. Okay? Pag naka-encounter kayo ng anti-adrenergic, kung kinontra na yung adrenergic, kinontra niya yung sympathetic, pasok ka sa parasympathetic. Kung kinontra mo naman yung cholinergic, cholinergic is identified sa parasympathetic. So in short, anti-parasympathetic. So pag kinontra mo siya, obviously the result is sympathetic. So dito na po tayo sa pag-use ng mga agonist at antagonist. Okay. Cholinergic, agonist. O agonist stimulate, ang cholinergic parasympathetic. Pag kinontra mo ang cholinergic, naging cholinergic antagonist, kinontra mo ang cholinergic, in short, you counteract action o parasympathetic sympathetic effect. So tulad sa adrenergic antagonist, you counteract sympathetic parasympathetic. Pag adrenergic agonist, stimulate mo yung adrenergic, anong gumagana? Sympathetic. So pag naka-encounter naman kayo ng mga enhancer, ibig sabihin, cholinergic enhancer. Enhancer stimulate yan. So cholinergic, associated sa parasympathetic. Pag adrenergic enhancer, ini-stimulate mo ang adrenergic, it's sympathetic. So ito naman po yung use ng mga tinatawag nating inhibitor or blocker. Similar po yan sa agonist. Kaya pansinin niyo, pagka antagonist, magkakapareho sila, di ba? Adrenergic antagonist, adrenergic inhibitor, adrenergic blocker. So pare-pareho yan. Kinokontra. So pag kinontra mong adrenergic, di ang result mo parasympathetic. So if you consider the inhibitor, blocking, and antagonist naman ng cholinergic, kinontra mo ang parasympathetic, ang result niyan ay sympathetic. Now, it's time to discuss naman pharmacogenetics. Actually, we have discussed this, yung pharmacogenomics or genetics, na each one of us have different inherited traits. However, it means that the response of everyone or each one of us may vary. Okay? Each one of us may vary ang response sa drug. Male, female, it may vary. Child, adult, elders, it may vary. Familial history with inherited traits or diseases, it may vary. Usually these are the what we call the area of pharmacology by which continuous studies are being done, lalong-lalo na sa mga, for example, sa mga Afro-Americans, sa Asians, ano po ang common toxic effects for drugs. Yun yung mga studies that will specifically identify in pharmacogenetics. So, let us now proceed with pharmacotherapeutics. Okay, now, pag sinabi nating pharmacotherapeutics, again, these are the drugs that we're talking about the desired effect. Okay? So anong big sabihin ng desired effect? Desired effect, ito yung mga drugs na na-encounter ninyo specifically on its purpose pag sinabi siyang ano yung purpose of drug. Okay, let's start. Empiric. Okay. Pag sinabi nating empiric, always consider po observation. What do you mean by observation? Example, yung practical experience. Di ba may mga ano tayo, supplemental drugs na hindi pa siya approved sa FDA, pero the patient claims na nag-cause siya ng treatment sa kanyang health condition. So ibig sabihin, habang ang drug po ay under observation, under trial, empiric po 'yon. So another example po, ang vaccines po natin ay still considered as empiric. Bakit? Kasi still nasa clinical trial 3 po ang ating pong COVID vaccines. Why? Kasi it undergoes still clinical trial at nagpa-facilitate pa ng consolidation of data kung ano yung adverse effect, ano yung side effect, ano yung indications, ano yung contraindications. Nung una, if you can still remember, may instances na 'di ba hindi muna po binibigyan ng vaccines ang children, ang pediatrics, pregnants. Kasi wala pang studies na itong mga COVID vaccines are safe. Kaya ngayon, ibig sabihin, nag-undergo tayo ng clinical trial because we want to document all of these experiences and facilitate specifically scientific references na ito po ay safe at will guide us on what are those cases that this may cause contraindication and what are those adverse reactions. So usually these are for observation. Okay? Next, number 2, supportive drugs. Okay. Anong ibig sabihin ng supportive drugs? Pag sinabi nating supportive drugs, you will consider sustain. Okay. You will consider sustain. Ibig sabihin, does not treat cause. O, example, can you give me, sir, example of supportive drugs? Pag sinabi nating supportive drugs, kaya from the word itself, sustain, example, the patient experience the what we call hypertension. Pero hindi siya known hypertensive. Okay? Hindi siya known hypertensive. Kasi pag ang patient ninyo ay known hypertensive, papasok na siya doon sa maintenance. So magiging regular na siya. Nakuha po ninyo? Magiging regular na siya na drug kasi uncontrolled. Maintenance are used pagka uncontrolled na. Chronic illness na siya. Ibig sabihin, lifetime na siya. Pag supportive is kung ang pasyente mo experiences hypertension, pero hindi ka naman hypertensive. O anong ibig sabihin ng does not treat the cause? Ibig sabihin ang pasyente mo ay hindi naman hypertensive. It so happen na nag-trigger yung increased blood pressure, so you need to consider supportive drug para makontrol yung continuous increase of blood pressure. The word is sustain. Can you give me another example, sir? Chest pain. Ang chest pain, hindi natin pwedeng masabing maintenance yan kasi hindi naman yan regularly tinitake. So supportive. For example, the patient has chest pain pero diagnosed siya. Ayan na ha. Ang diagnosis niya ay ang patient mo ay merong heart problem. Okay, for example, bigyan na lang natin sa diagnosis ng arteriosclerosis. Pag sinabi natin sclerosis, this is the medical term for hardening of blood vessels. So hardening po ang arteries. Ngayon, ang patient mo nag-chest pain. So ibig sabihin yung supportive drug that you will give is to manage chest pain. Pero hindi natin tinitreat yung problem with arteriosclerosis. So will it be similar, sir, na kung for example, ang pasyente mo is probably known, okay, with diagnosis, pero hindi naman siya wala siyang maintenance drug na identified. Yon. So tulad nun, hindi naman kasi at all times nakaka-experience ng chest pain. So we really need to support to prevent the what we call complications. Okay? So that is what we call supportive. Ano naman yung palliative? Okay. Kung nadidinig nyo yung hospice at saka yung palliative care, pag palliative, these are mga illnesses na somehow hindi na siya, nasa end stage na siya and may not anymore be subject to conventional treatment. Example, end stage cancer. Hindi na siya isa-subject sa chemotherapy, pero you will just manage it doon sa mga symptoms na magmamanifest sa kanya such as pain. So example, hindi mo na palliative care ha, eto na yung mga end stage. These are situations na okay, hindi na iki-chemotherapy. Pero paano po if the patient will experience pain? So magpo-focus na tayo on symptom base, ha? Symptom base. Hindi natin matitreat specifically yung mismong diagnosis kasi it's end stage, pero imasusupport na lang natin yung palliative para ma-alleviate yung mga symptoms at discomforts. So one of which is pain. So another, ang patient mo ay nasa end-stage renal failure or kidney disease. So medyo mahirap na din to subject the patient for what? For dialysis. So ang a-alleviate na lang yung ano niya kasi since risk ang pasyente na may kidney failure sa anemia or bleeding, ang patient mo ay bibigyan na lang ng palliative drug para to support prevention of bleeding. So, iyan lang, yung mag-alleviate lang sa pain ng pasyente at yung condition na magli-lead into prevention of complications. Pero yung terminal kasi, pag sinabi natin terminal end stage, the patient is not anymore on conventional treatment. O eto na, maintenance. Sa maintenance naman, anong pinagkaiba niya sa supportive at saka sa maintenance? Example, ang maintenance, patient mo known hypertensive, uncontrolled. So the patient will take the drugs for lifetime na. Unlike for supportive, ang patient mo kahit hypertensive siya pero controlled, hindi kailangan ng maintenance, pero nag-hypertension siya, bibigyan mo lang siya once. Pero itong maintenance kasi, it's already lifetime. Another chronic illness, diabetes. For diabetes, ang pasyente mo may possibly consider po a perspective na hindi na rin siya kung meron tayong tinatawag na diabetes na diabetes na controlled. So if ever this will cause the possibility that they may consider ang problem kasi natin for the maintenance, ang concern po natin for maintenance drug, dapat continuously to i-take para makontrol. So, yon tulad ng diabetes, kailangan niyang ma-take yung drug, yung regular drugs niya, regularly or each day para makontrol naman yung blood sugar. So, yun tayo. Next, ano naman po yung supplemental? Most of the supplemental ay eto naman po ay prevention. Okay, prevention, replenish, substitute. Kaya usually pag nakakadinig kayo ng supplemental, eto yung mga uh, no approved therapeutic claims. Ito yung mga multivitamins, herbal drugs, pero merong FDA approval. Pero ito yung no approved therapeutic claim. Ibig sabihin, ang supplemental drugs hindi po siya magko-cause ng treatment of any disease. Okay, nire-replenish lang niya. Example, parang simple as dehydration, magbibigay ka specifically ng magbibigay ka ng Hydrate. 'Yon. Another, the patient is on the physical activities, expect maraming ma-consume na vitamin reserve sa body, so nagte-take ng multivitamins. So nire-replenish lang niya, but it doesn't direct to treat the disease itself. Next, 6, acute. Pag sinabi nating acute, these are therapeutic drugs that are being given to a patient who is critically ill. So ano yung acute intensive therapy? Pag sinabi nating acute, critical yung condition niya, pero kailangan niya mag-start at the early stage. Example, 'di ba when the patient was diagnosed with cancer, they will be suspecting na that the patient may undergo na chemotherapy at magre-receive siya ng chemotherapeutic drugs. Acute siya, stage 1. Pero pag ang pasyente mo nasa end stage, hindi na siya possibly chemotherapy, papasok tayo ngayon doon sa alleviate ang purpose. So pag ang acute is basically example, the patient will undergo chemotherapy, magre-receive ng chemotherapeutic drugs, any procedure that will cause prevention of complication, then that is what we call acute. Okay? So, what are the therapeutic steps? So, this will be the last because we're about to end at 7. So, Therapeutics test, we need to know the patient's conditions or a patient's problem. We need also to consider the regimen of the patient when taking the drugs kasi we need to connect with them with the trust. So, pag sinabi natin kasing therapy, ito yung mga therapy by which kung bakit siya therapeutic because basically it will consider po continuous support through the meeting the desired effect of the drug. And the monitoring of effectiveness of therapy or the drug must be with the continuous feedback of the patient and monitoring of the nurse. So probably I may end up to this topic because we are now overloaded with information, and I will just post announcement in our chat group if the self-assessment exercise are already posted or available. So, do you have any questions? Any questions po so far?